9:23 p.m., Mercy Ridge Medical Center. A SEAL captain rested on the stretcher, his limb pale, bloated, and losing circulation rapidly. Two physicians hovered over him, debating in hushed, grave tones. Blood flows ceased, one murmured. "We might need to remove it." The captain tightened his jaw until he spotted her. A rookie caregiver walked in quietly, carrying a tray of medication, young, blonde, gentle-voiced, the type everyone disregarded. The physicians didn't even pause, but the captain froze. Then, to everyone's astonishment, he raised his functional hand and saluted her. "Ma'am," he murmured, voice quivering, "you rescued me once in a firefight. Don't you dare permit them to take my limb." The space went silent. She attempted to retreat. "No, I'm not that individual anymore." But the captain locked gaze with her. "Course, Pullman, please. You're the only one here who understands how to repair this." The physician scoffed. "A caregiver? This is impossible." She examined the dying limb, the collapsing vessel, the recollection she'd buried. Then she stated softly, "Grant me 3 minutes." And what she executed next, no standard medical center had witnessed before. Before we begin, take 2 seconds to comment where you're watching from and hit subscribe. Your support keeps these stories alive. All right, let's get into it. 9:18 p.m., Mercy Ridge General Medical Center. The emergency department was unusually loud for a Tuesday evening. Residents scrambled, caregivers rushed, sirens chimed, and stretchers filled every corner of the critical floor. Nobody noticed the paramedics rolling in, yet another casualty, until they witnessed the uniform. A Navy SEAL captain, tall, muscular, jaw tightened, face drained of pigment. His left limb strapped to his torso with makeshift wrapping soaked through with darkening crimson. A training mishap, they were informed. Fractured limb with severe vascular compromise. Possible removal needed. 2 residents gasped. One murmured, "I've never witnessed a limb that bloated." The critical care physician on duty, Dr. Marcus Vale, the region's finest, stepped forward with that cold confidence physicians wear like armor. "Let's transport him to Section 4, Vale commanded. "Prepare for surgical removal. He's losing the appendage." The SEAL captain didn't flinch, but his jaw tightened just enough to betray agony. He gripped the stretcher rail, breathing in short, controlled bursts, the manner soldiers do when they refuse to display weakness. "He's a warrior," a resident stated. "No," Dr. Vale corrected. "He's a man about to lose a limb." They pushed him into Section 4, curtains half drawn, fluorescent illumination reflecting off steel trays. A caregiver read off the vitals, tone shaky. The captain shut his gaze, swallowing hard, his breathing steady but forced. The residents gathered around, excited to witness the physician at work. Then the curtain rustled. A young woman stepped in quietly, almost unnoticed. Rookie caregiver. Light blonde hair pulled into a low bun, navy scrubs slightly too large for her, clipboard tucked into her elbow, gaze soft, posture timid. A woman everyone ignored. Her name tag read, "Nurse M. Bennett." "What are you executing?" Dr. Vale snapped. "This section is restricted. We're preparing for surgery." She froze mid-step. I was just requested to bring the injection kit." A few residents chuckled under their breath. "Of course, the rookie is lost," someone muttered. But the SEAL captain opened his gaze at the sound of her tone, and everything in him stopped. He blinked, stared, focused. Then, without warning, he attempted to sit upright, agony tearing across his expression, but he forced through it. Even Dr. Vale stepped back from shock as the SEAL captain raised his functional limb to his forehead and saluted her. Dead serious, perfect form. No hesitation. A salute weighted with history. The space fell silent. Even the equipment sounded quieter. The rookie caregiver's expression went pale. "Sir, please, don't. You'll injure yourself." "You?" The SEAL captain breathed, tone cracking. "I knew it. I knew I wasn't imagining it." "Bennett? Nightshade? Is that really you?" A resident frowned. Nightshade, another whispered. Is that a call sign? Nurse Bennett stepped back, shaken, her throat closed up, hands trembling just slightly. I'm not her anymore, she murmured. But the captain wasn't hearing it. His gaze were burning with a mix of agony, respect, and something like gratitude. You rescued my existence in Afghanistan, he stated. Torso injury, ambush en route Kandahar. You carried me out when the others. He swallowed hard. You transported me home. The residents froze. The physician's confidence fractured. Even the screen seemed to pulse slower. Nurse Bennett glanced away sharply. Please, I don't execute that anymore. Vale coughed, attempting to regain control of the scene. Miss Bennett, whatever your history is, this is a surgical situation. His appendage is gone. We're preparing for removal. Her head snapped toward the scans on the display, and something in her changed. The timid posture vanished, her gaze sharpened, her breathing steadied. The gentle-voiced rookie caregiver was replaced by something colder. Trained, disciplined. Why remove? She asked quietly. Vale scoffed. Because the radial vessel is collapsed, circulation ceased. Tissue death is minutes away. This is not a caregiver-level situation. She stepped closer, but the compartment pressure appears reversible. It's not. Yes, she stated, tone suddenly steady. Yes, it is. Vale crossed his limbs. You think you comprehend more than I do? The SEAL captain exhaled in agony. Permit her to attempt, he stated through his teeth. If anyone can rescue my limb, she can. Vale spun toward him. Captain, with all respect, she's a rookie caregiver. She's not qualified to. Bennett wasn't listening. She leaned over the injured limb, her digits moving with precision no rookie should possess. She pressed along the muscle compartments, analysing pressure, direction of bloating, mapping the vascular collapse with touch alone. Sir, she stated to Vale, this isn't death. It's delayed arterial contraction with collapse from the trauma load. The pieces are compressing the sheath, not severing it. Vale opened his mouth, then closed it. Residents blinked in confusion, because none of them had witnessed that terminology used outside battlefield medical tents. What does that mean? A resident asked. Bennett looked up calm and certain. It means we don't remove. The SEAL captain exhaled in relief, gripping her wrist with gratitude. I told you, he murmured. Nightshade always rescues her individuals. Stop calling me that, she murmured. Vale tightened his jaw. Even if you're correct, no standard medical centre executes that variety of stabilization. She hesitated, then quietly stated the words that froze the space again. I execute, Vale stared. You're informing me you comprehend a technique that isn't even authorized outside combat zones. I'm informing you, she replied softly, that he'll lose his limb if we wait for you to prepare the operating room. The SEAL captain nodded, gaze locked on her. Please, he stated, just attempt. She closed her gaze for a moment. Her breath shook, recollections she never desired, resurfacing crimson dust, her partner dying in her grasp, her hands failing him, her tone begging him not to depart. But she opened her gaze again, steady, focused. Fine, she murmured, I'll execute it. The resident stepped back instinctively, as if witnessing something sacred. Bennett grabbed the sterile kit, sanitized, gloved up, then positioned herself at the SEAL captain's side. Pressure the proximal section, she commanded. Vale blinked. What? She looked up. If you desire to assist, she stated evenly, hold pressure. Now, no one had witnessed her give a command before. Vale obeyed. She worked rapidly, controlled, confident, hands moving like someone who'd executed this 100 occasions under gunfire. She performed a stabilization release maneuver. None of the residents recognized, something taught only in elite combat responder programs. The SEAL captain tightened his jaw, gasping, but then his digits twitched. Then again, then slowly, circulation returned. Pigment crawled back into the hand. A resident murmured, What? What did she just execute? Vale stared like he was witnessing a miracle, and Nurse Bennett stepped back, torso rising and falling, gaze glassy with recollection she couldn't escape. "It's finished," she murmured. "He's stable," the SEAL captain breathed out in relief, moisture forming. "Nightshade, you rescued me again." The rookie caregiver swallowed hard. "I told you," she stated quietly, "I'm not her anymore." But before anyone could speak, a tone from behind the curtain stated, "Actually, we must discuss that." Bennett turned slowly and froze because standing there was someone she never anticipated to witness again. Someone who comprehended exactly who she used to be and why she departed the military forever. The moment the curtain slid shut behind them, the space changed. The chatter outside faded. The fluorescent illumination hummed overhead. The SEAL captain sat upright, cradling his bloated limb, gaze fixed on the rookie caregiver like she was a ghost pulled straight out of the desert sand. Maya Thompson maintained her gaze on the supply cart instead. She pulled gloves, alcohol wipes, sterile packs, anything to avoid meeting his gaze. "Maya?" Captain Riley stated softly. She froze. He hadn't stated her name like a question. He stated it like a recollection. But she maintained preparing the injection tray, pretending not to hear. If she permitted him to speak, permitted him to remember, permitted him to bring the history into this space, everything she had rebuilt in the last 7 years would crack open again. "You don't need to execute this," she murmured. "I'm just here to provide the antibiotic injection and depart." He exhaled a slow breath that carried a weight no one in this medical center would comprehend. "I comprehend who you are," he murmured. Her hands trembled for the smallest second, but she didn't turn. "You shouldn't," she stated. "That existence is gone. Permit it to stay gone." Behind them. Dr. Sullivan stood by the computer charting notes loudly on purpose. Still irritated that a rookie nobody had been permitted inside his critical section, he tapped his pen against the desk, glancing at Maya with thinly veiled annoyance. "You finished yet?" he muttered. "We must prepare for removal. The longer you're in here, the more duration we waste." Captain Riley's jaw tightened. "We're not removing. You don't receive a vote," Dr. Sullivan snapped. "You're the casualty. I'm the physician." Maya stepped forward, then slow, quiet, but with that strange calm she always carried. "Sir, your casualties' perfusion is decreasing. The window is shrinking." Dr. Sullivan shot her a glare. "Thank you, caregiver. I'm aware of my task." But Captain Riley wasn't listening to the physician at all. Only to her. "Do you remember Ramadi?" he asked. Maya's breath caught. She shut her gaze for one pulse. Maybe two. The recollection wasn't a single picture. It was a flood. Shrapnel slicing the atmosphere, sandstorms choking the sky, her partner Derek falling right in front of her, and the sound she could never forget, a gunshot cutting through the heat like a blade. When she opened her gaze again, everything about her expression had changed. "Yes," she murmured. That was the first moment Dr. Sullivan finally examined her. Really examined her. There was something in her posture he'd never witnessed from a rookie. Something controlled, trained, military. But he dismissed it just as quickly. "Captain, I comprehend you're emotional, but this caregiver is not qualified for anything except handing me supplies." Captain Riley lifted his uninjured hand slowly and saluted her. Dr. Sullivan's jaw fell open. "Nurse Thompson rescued my existence," Riley stated, tone steady. "She dragged me 1/2 a mile under gunfire with a bullet in my lung. If there's one individual in this medical center I trust more than you." His gaze moved to Dr. Sullivan, cold and clear. "It's her." Maya's pulse dropped into her stomach. This was exactly what she feared. Recognition, recollection, exposure. She maintained her tone low. "Captain, that was a long duration ago. And you're still her," he stated. Dr. Sullivan slammed his chart shut. "Enough. This is absurd. Nurse Thompson, retreat from the casualty." But Captain Riley didn't permit her. "Maya," he murmured, "examine my limb." She did. The flesh around the bicep was turning a sick shade of purple. The pulse at the wrist was faint, barely there. His hand was already colder than it should have been. Compartment syndrome, crushing pressure, no circulation. If they didn't restore circulation in minutes, the limb was gone. "What do you witness?" he asked quietly. Maya swallowed. She witnessed it all, things no one else in the space would recognize. "Pressure lockout," she murmured. "Vascular choke. Your forearm opening was executed wrong." Dr. Sullivan stiffened. "Excuse me." Maya didn't back down. "The previous cut wasn't deep enough. Crimson's trapped. If you remove now, you'll remove a salvageable appendage," Dr. Sullivan scoffed. "You're guessing." "She isn't," Captain Riley stated firmly. Maya shook her head hard. "Don't state that." "Why not?" he challenged. "You rescued me once. Rescue me again." Her gaze flickered, not to the physician, not to the injury, but to something far away, an expression she would never witness again. Her partner, the one she couldn't rescue, the reason she departed the military. "This is different," she murmured. "No," Riley stated softly. "This is the same. Someone is going to lose their existence or their limb unless you intervene, and I comprehend you can execute it." Her breath shook. Dr. Sullivan threw up his hands. "This is ridiculous. We don't possess duration for sentiment." Then something occurred he didn't anticipate. Maya moved, not rapidly, not loud, but with purpose. She reached for the sterile kit, tore it open with practiced precision. Her body shifted into that stance, the one only combat responders used when they were seconds away from losing a soldier. Dr. Sullivan's expression twisted. "What do you think you're executing?" Maya didn't examine him. "Sir," she stated calmly, "your casualty possesses a collapsing radial pulse, modelling in the digits, and a vascular block that's seconds from irreversible shutdown. If you remove now, you'll remove an appendage that can be rescued." "That's my decision," he barked. "No," she stated quietly. "It's the correct medical decision." Captain Riley watched her with something that wasn't terror anymore. It was respect. Maya positioned her digits gently along his limb, feeling the pulse line. "There," she murmured. "It's trapped under the fascia." "How do you comprehend?" Dr. Sullivan demanded. She finally examined him. "I've relieved this pressure in the field twice." Dr. Sullivan recoiled. "You in the field?" Maya didn't blink. "Under gunfire." The spacer went silent. Then the physician stated the one thing she comprehended he would. "I won't authorize it." Maya comprehended this would occur. She also comprehended what came next. Captain Riley lifted his chin. "I authorize it." "You can't," Dr. Sullivan sputtered. Riley cut him off. "It's my limb, my decision, and I choose her." Maya breathed in slowly, steadying her hands, steadying her pulse. "No standard caregiver should comprehend this technique," Dr. Sullivan stated. "No standard caregiver does," Riley replied. Maya met the physician's gaze finally, openly. "Retreat," she stated softly. Dr. Sullivan hesitated. Captain Riley didn't. "Execute it, Maya." Her digits tightened around the blade. She murmured almost to herself, "Please don't make me remember this." But it was too late. Her history was already awake. She made the first incision. Dr. Sullivan gasped. "No, that's incorrect." Maya didn't halt. She opened the fascia along the trapped vessel, the combat responder manner, defying every standard protocol in the book. For 4 seconds, nothing occurred. Then circulation surged. Pigment returned to the hand. Captain Riley exhaled, relief crashing through him like a wave. Maya stepped back, shaking. The space was silent. Dr. Sullivan's expression went pale. Captain Riley murmured one word. "Valkyrie." Maya turned away instantly. "I'm not her anymore," but her tone cracked. Dr. Sullivan stared between them, stunned. Who are you?" Maya didn't answer. She walked toward the entrance, slow, silent, leaving the space in absolute disbelief. But before she reached it, a tone behind her stopped her cold. "Wait," she froze. Captain Riley stated softly. "Maya, "There's something I must inform you." Her crimson ran cold, and when she turned around, he wasn't examining her injury or the tray or the physician. He was examining her with something deeper, something dangerous, something she wasn't ready to confront. "It's about Afghanistan," he murmured, "and the day you think you failed." Maya's torso tightened, her digits curled into fists. The history she attempted to bury wasn't finished with her, not even close. Comment: never judge if you're still with the story. The surgical squad dispersed across the corridor like a tide retreating after a storm, carrying tablets, forms, and concerns that seemed to echo through every corner of the orthopedic wing. But Sarah remained still. She leaned against the barrier outside Recovery Section 4, staring at the floor tiles with the same expression she had worn in Afghanistan the evening. Everything changed, calm on the surface, but cracked underneath. Only now she wasn't holding a rifle. She was holding a clipboard. Inside the space, Captain Riley Anderson rested with his limb finally wrapped, stabilized, and rescued by her. The very thing the physician desired to cut off, she brought back with a maneuver no standard responder would dare attempt. The attending physicians departed the space whispering to themselves, attempting to piece together how a caregiver, a rookie one, reversed something they had already declared hopeless. Dr. Martinez, the senior critical care physician, walked past her, pausing only long enough to avoid eye contact. "You went beyond your role today," he muttered. She nodded. "Yes, sir." He hesitated, something uncharacteristic for him, "but you also rescued his limb and maybe his career." Then he departed. She exhaled shakily, pressing her thumb against the spot where her identification badge hung. She anticipated reprimand or praise or anything, but mostly she anticipated silence. That was what she was accustomed to. That was what she'd accepted. A quiet caregiver in a loud existence. The entrance opened. Captain Anderson stepped out, still in his medical center gown, sling supporting the limb she'd restored. His other hand rested against the entrance frame as he steadied himself. "Sarah," he stated softly. She froze for the first occasion all evening. His tone wasn't the tone of a casualty. It wasn't the tone of a stranger. It was the tone of a man who had once laid dying on a dirt floor beside her. "Don't," she murmured, "not here." But he didn't move closer. He only studied her expression the same manner he had in Afghanistan. Crimson pooling under them both, dust clinging to their uniforms, and her hands attempting desperately to maintain him breathing after a sniper round tore through his torso plate. "You still wear the identification tag?" he asked, her jaw tightened. "How long have you comprehended?" she deflected. "Since you walked in," he stated, his functional hand lifted into a perfect salute. Slow, deliberate, deeply respectful. The same salute he had provided her back then when he woke up in a field medical center with her at his side. She didn't return it. She couldn't. Her throat clenched too tightly. A passing caregiver gasped softly, stopping mid-step as she realized what she was witnessing. A Navy SEAL captain saluting a rookie caregiver. A physician peeked around the corner. A respiratory technician froze with a cart. Even a janitor paused with his mop halfway across the floor. The corridor seemed to hold its breath. "Sarah," he stated again, lowering his limb, "you rescued my existence today. Again." She stared straight past him into the empty waiting area. "You should rest, Sarah." His tone gentled. "I remember more than you think." Her digits trembled around the clipboard. The first twist came quietly. "Your partner?" he stated. "The one you lost. He was my radio operator. You never comprehended I witnessed it occur." Sarah's gaze snapped shut. No one mentioned that day aloud. Not in 3 years. Not in therapy. Not in standard existence. Not even in her own consciousness. She attempted to bury it under shifts, routines, new uniforms, and new identities. Anderson shifted his weight. "You're fleeing," he stated, "but you don't need to anymore." She opened her gaze. "Halt," she murmured, but there was no anger, just terror. He stepped closer, careful not to touch her. "You rescued my existence then. You rescued my limb today, and I still haven't thanked you for either. You thanked me, she stated, her tone barely a breath. You saluted me before they transported you away for evacuation. He shook his head. That wasn't a thank you. That was respect. He swallowed. A thank you is different. In the silence that followed, the fluorescent illumination buzzed softly overhead. The evening shift was beginning, and the medical centre's energy shifted quieter, slower, dimmer. Sarah, he murmured, you didn't lose your partner because you failed him. You lost him because conflict is cruel and random. You rescued everyone you could. Her pulse punched against her ribs. She stepped sideways, gripping the barrier rail. You don't understand, she stated. I froze. You didn't freeze. He stated it with absolute conviction. You carried 2 men out after that. You dragged me across a courtyard under gunfire with your leg bleeding. You shielded me until extraction arrived. That's not freezing. She shook her head, moisture threatening but not falling. Halt talking like you were there. I was, he stated gently. Agony flickered across her expression deep. Sharp, raw. She turned away, walking toward the quiet end of the corridor, where no one else cared enough to follow. Anderson stayed a few steps behind her, providing her distance but not permitting her to drown alone. Examine me, he stated softly. She didn't. When you departed, he continued, I understood why. But fleeing from who you were doesn't make the history depart. She halted, walking. If you maintain burying it, he stated, you're going to lose yourself. A long, trembling silence filled the empty corridor. Finally, she turned. Just barely, just enough for him to witness her gaze. What if I already possess? She murmured. He inhaled sharply because that was the second twist. That was the real injury. Not the conflict, not the partner, not the discharge. It was the belief that she didn't deserve to still be here. Sarah, his tone cracked. You rescued me again today? Not because you're lucky, not because you stumbled into the space, but because you're who you've always been. You are the finest combat responder I have witnessed. She squeezed her gaze shut, attempting to force the moisture back. You think the physicians didn't notice? He asked. You think they don't comprehend you're something extraordinary? They'll terminate me, she murmured. They'll figure out I'm not supposed to be here. You belong here, he stated. Maybe more than any of them, she shook her head. No, I'm attempting to be someone else now. Sarah, he murmured, you can't be someone else. You're you. Her breath shuddered. Just go rest, she pleaded. Please. His expression softened. I will, but not before I inform you this. He stepped forward slowly until he was close enough for her to witness the earnestness in his gaze. You didn't fail your partner. Her digits froze. He didn't perish because of you. The third twist came like a quiet detonation. Anderson murmured, He perished, rescuing you. The corridor spun around her. Her knees nearly buckled. Her partner hadn't perished because she couldn't rescue him. He perished to rescue her. She couldn't breathe, couldn't speak. A caregiver at the end of the corridor glanced over, sensing something was incorrect, but didn't interrupt. Anderson reached out with his functional hand, but didn't touch her. He just waited. You didn't comprehend, he stated softly, and that's why you've punished yourself. Her tone was barely a tremor. Why didn't anyone inform me? Anderson's expression turned sorrowful. Because sometimes the truth aches more than the lie, and they thought they were protecting you. She stared at him, shattered, shaken, unraveling. He lowered his tone. You deserve the truth, and you deserve peace. Something inside her splintered, not shattering, but opening. She managed a murmur. I don't comprehend who I am anymore. Anderson exhaled. That's the part we figure out together. Before she could respond, a sudden chime echoed overhead. Code Blue Recovery Section 4. Anderson's gaze widened. That's my space. Sarah spun toward the corridor. The captain's screen, the one she stabilized earlier, had just flatlined. And without waiting for authorization, without hesitation, without terror, Sarah ran. Sarah sprinted down the corridor, her shoes slamming against the polished medical center floor, the overhead illumination streaking above her like the recollection of a battlefield she never desired to remember again. Caregivers parted instinctively. Residents stumbled out of her manor. Even orderlies froze as she shot past them, like a bolt of controlled lightning. Recovery Section 4. Anderson's space. The same man who minutes ago informed her she deserved peace. The same man whose existence she'd pulled back from the brink with nothing but instinct, scars, and a technique she hadn't used since Afghanistan. She reached the doorway, and the sound struck her first. The piercing, high-pitched drone of a flatline, a monotone scream, a death sentence. Sarah shoved the curtain aside. 2 residents were already there, fumbling over his body, attempting to push medications, attempting to adjust pads, attempting to revive him, attempting and failing. Sarah, don't, one of them snapped, but she wasn't listening. She was already beside Anderson, digits on his neck, registering the faintest warmth, the slightest hint of lingering electrical activity under the flesh. Not a pulse, not existence. A chance, a single chance, one she refused to waste. She reached over the panicking resident, grabbed the defibrillator paddles, and adjusted their angle just a few degrees. But degrees that mattered. Clear? She murmured. They stared. Caregiver, you can't hit it, she commanded. The shock fired. Anderson's torso jerked, but the screen stayed flat. One of the residents swallowed hard. Call it! Sarah didn't blink. No. Her tone was low, calm, unshakable. The tone she used the evening she held a Marine's vessel closed under gunfire while mortar rounds crushed the valley around them. She adjusted the pads again. This occasion, she reached beneath the bed, lifted his limb, repositioned it slightly to change the conduction path of the impulse, something only combat responders learned, something no standard textbook mentioned. She nodded to the resident again. Again, ma'am. Again, the shock struck. A second jolt and then a flicker on the display. Just a flicker, the smallest blip of electrical defiance. Sarah leaned closer, inches from his expression, as if her proximity alone could anchor him back to the existence. Come on, Captain, she murmured. I didn't rescue you once, just to lose you now. Another blip, then 2, then a rhythm. Weak, fragile. A newborn pulse trembling its way back into existence. The space went silent. Residents stared at her as if she'd just bent the laws of medicine with her bare hands. Anderson gasped softly, eyelids twitching, torso rising again. Sarah stepped back, breath shaking, her hands covered in perspiration. The residents examined her like she was something between a miracle and a myth. Sarah, one murmured. How did you? She didn't answer. She didn't need to. She took a shaky breath, her torso rising with something that felt too large, too heavy, too long buried. Anderson's gaze opened only for a second, but in that second, he examined her like she was the only steady thing in the existence, like he comprehended she'd rescued him twice now, like some part of him remembered Afghanistan, remembered her tone screaming his name through dust and crimson and chaos, remembered her dragging him out of a kill zone with shrapnel in her own leg. His lips parted. A rasp. Sarah. But the effort pulled him back under, and his eyelids slid shut again. This occasion peacefully, not painfully. Sarah clenched a trembling hand against her torso. Every breath she took burned. Every instinct told her to collapse. Every recollection told her to flee. Instead, she stood there still breathing, watching the pulse she rescued pulse steadily across the screen. She didn't notice the physician behind her, didn't hear the soft footsteps, didn't feel the hand hovering at her shoulder until he spoke very softly, very honestly. You didn't just rescue my boy, he murmured. You rescued me. Her gaze stung, her throat closed. For years, she carried shame like armor. Now, someone handed her something different, something she wasn't certain she deserved. Recognition, gratitude, a place she belonged. And when she finally turned toward him, her tone cracked. "Why do individuals maintain thanking me for surviving?" she murmured. "Because survival," he stated gently, "is an act of courage too." Sarah examined back at the screen at Anderson's pulse growing stronger, and something inside her shifted. Not healed, but no longer hiding. And now, the moment that defines your ending. If you felt this story, please subscribe. I don't ask this lightly. Your support is the only reason stories like Sarah's exist. If you're still reading right now, I'm asking you from the heart. Subscribe before you leave. Don't miss the next story.